I'm Dana McKinney, Clinical Care Navigator for the Indianapolis office. Work hand in hand with the nurse practitioners and then work in conjunction with the engagement team, kind of wrap around care and just provide full service for patients. I worked in primary care for years and then went into population health, so kind of doing the same thing, navigating patients through the healthcare system. But Wayspring's different, so we meet patients where they're at as opposed to getting them where we want them to be. You know, we're here to pick you up when you stumble. We're not going to turn our backs. We're just going to continue to support you throughout the whole process. So it's different as opposed to a large healthcare company. You know, you got to be at these appointments. You can only miss so many, those kinds of things. I feel like we're a little more lenient and kind of allow this population of members and patients to kind of guide their own path. So our population of patients with substance use disorder, kind of feel like sometimes we got to guide them in the right direction and show them the things that they don't necessarily know, or they're getting recently out of incarceration and they've been incarcerated for some time. So it's a lot of taking time and educating and being patient. It's very eye-opening to see the struggles and to see the way that they maneuver through those things, and just their drive and determination and their courage to not only share their story, but to share just their lives in general. We work in conjunction with Dawn, our care partner. We then refer those patients to her for housing needs or employment needs, applying for disability and food stamps, those kinds of things. And she just kind of goes above and beyond to make sure that all those needs are met and follows up with them routinely. It's a whole new world to be able to just offer all those things. So we have one member that we work with. He's a standout patient to me because he's consistently struggled, but every time he calls, he says, you know, you guys never give up on me. My mom gave up, my dad gave up. You guys never do. And that means a lot. To know that you're making a difference for him. My dad was an alcoholic for a long time. He's been sober for 35 years now. But my brother's an alcoholic. So just supporting those people that don't get support. And I've seen it firsthand. So that's my why. I think previously, just from past history and my family and that kind of stuff, I was pretty much a hard no on second chances. But I think after being here and seeing the work that these patients put in, just the drive and determination to get sober, it really opened my eyes to see that it's not just a one and done thing. Just because they fall backwards doesn't mean they're not trying. That's been very eye-opening for me. So Wayspring as a whole, it's very community driven. Different markets reach out all the time, so it's not like just because I work in Indiana, I never talk to Delaware or Kentucky or Tennessee. There's definitely a lot of collaboration just across the board with shooting ideas and that kind of stuff. And it's nice to be with people that are just comfortable and accept you for who you are. We consistently say in our office, this is a safe space. Nothing here is going to be judged. You can tell us anything. That's just nice to have that.